Life and Living is made up of real-life stories from very real people, whose identities and circumstances have been concealed. These testimonies were shared in order to inspire others to seek prompt solutions to their fertility issues.
Life and Living series presents All is Well That Ends Well. Mom, we need to talk.
Samuel, I hope you're not in trouble again.
It's not about me, Mom. It's about you. You and my father. This is about how you guys have embarrassed me.
Samuel, what is going on?
I don't get it. How can you guys be expecting another child after 20 years? Oh.
I see. So that is what your vexation is about, eh?
So you think this is a laughing matter?
I see that even after 20 years, someone is still jealous of having a sibling.
Oh, come on, Mom. Look, that can't be the case. But seriously, my friends are making jest of me. They're saying that when my younger brother, sister, or whatever is born, they won't be like my sibling. They'll be like my own child. Look, you guys have just dented my rep.
Samuel, we would have had this pregnancy much earlier if we could. But things got out of control, and that is what is responsible for the delay.
I see. So tell me about it.
I wasn't born in your times, with laptops and the internet. I was born in the village, and by the time I was 16, I got married. I immediately got pregnant with you. Then some years later, I took in for... or so I thought.
Caro, is this your face?
Oh, my sister. Since I took him for this second child, I have not been myself.
Your husband did not even give you space. It seems like he likes to stay sharp.
Yes, sir. And I feel so tired and heavy.
Maybe you should try resting.
If I rest, who will do the work? Don't worry. It is my cross. Leave me to carry it.
From the way I'm looking at you, this one will be a girl.
Don't worry. You will all know in a few weeks.
Okay. Take care. Smile.
Thank you, my sister.
Caro, my daughter, what kind of disgrace have you brought upon our family?
Mama, what is it again?
You've been carrying this pregnancy for over 2 years now, and are not showing any sign that you will deliver soon.
But Mama, it is not my fault.
Shut up! It is all the wicked things you've put your hands into that are coming back to haunt you. How can a young girl like you have this kind of curse? Who did I offend?
Mama, I don't know. But it is not your fault.
We must find a cure to this madness. We must.
Onímẹ̀kẹ́sà lórúkọ tá à ń pè wọ́ Ṣàngó, àjẹkàtù lórúkọ tá à ń pè wọ́ Ọjọ́, lágbóǹkìyìn lórúkọ tá à ń pè yín àjẹ́. Ṣàngó sátijọ́ lẹ́yìn nígbà tí ẹ̀yin máa pọ̀ ọmọ Ọ̀rúnmìlà. Ó ní kí ẹ̀yin máa dáhùn torí pé kí ni ọjọ́ tí ẹ̀yin bá dáhùn ọjọ́ náà ní ẹ̀yin ó parun. Torí pé kí ni ìdáhùn ní ń parun, ìdárin ní ń pèrè.
Wise one, we have come.
I sense a strong force around this place, yo.
See, I told you that something is worrying you.
Hey, woman, let the wise one do the talking. Hey, OJ, my daughter, what is the problem?
You see, I have been pregnant for a long time.
Iwájú ọpọ́n Ifá ọgbọ́, ẹ̀yìn ọpọ́n Ifá ọgbọ́, olùmúlọ̀tún, olùmọ̀ràn lósì, àárín Ifá ìta gbangba ọ̀run. How long is long, my daughter?
It started after I delivered my first child. I took him for the second child, but for over 2 years, I have not been able to deliver the child.
Order. Come close, let me touch it. ayé mọ̀ níkà o. Ọ̀yẹ̀là bẹ́jà bá sọ lùdọ̀ àrísàlẹ̀ omi ọ̀yẹ̀là. My daughter, this is a big task yo, but you have come to the right place. Bẹ́ẹ̀ni, this is what you will do. Bring 10 strings of red cloth, 2 sacks of tortoise shells, 1 black cock, 10 elephant toenails, and 1 keg of palm oil. You will come back here on the day of full moon for the sacrifice.
Thank you, wise one.
So, are you going to deliver the baby?
Shush! Foolish child.
Hey.
Do you want the anger of the gods to spoil this ritual? Let's go. Wise one, we'll be back.
But Mama, I have to ask now.
Let's go.
Go safe o.
Choose wellness. Choose health and vitality. Know your numbers.
This is a corporate social responsibility message from Pathcare, Nigeria's foremost pathology laboratory.
Hold it! Take off your shoes. This is holy sand. The spirits have already announced your coming.
Yes.
They tell me you have a spiritual husband. But today, Zanzibar, today your problems will be over.
Yes.
You will leave her here. She will do 7 days dry fast.
Anything you say, prophet, we will do.
Early!
Mama, please now.
Shut up! Shut up! How can you be carrying pregnancy for 10 years? 10 years!
You must be delivered today.
Today!
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 Fire!
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 Bring your head, let me smell it. Get out! Get out! Leave this place now! Leave this place now! Zanzibar!
My in-laws, I greet you.
We greet you.
I have come here because of my wife. We have tried so many places, but no one seems to have the solution.
So you know. Do you have a better solution?
Well, I want to take her to the city to see a proper doctor. All these people we have taken her to have not helped.
My son, you have paid her bride price. She is all yours. I only ask that you take care of her.
Thank you, Papa. That won't be a problem.
I can't believe this.
Doctor, what is it?
How long did you say she was pregnant for?
10 years.
And you didn't get any medical attention?
No, but we went to see many native doctors.
Your wife hasn't been pregnant. She has what we call pseudosciasis.
Pseudo what?
Pseudosciasis.
Doctor, is that another way of saying she has a spiritual husband?
Not at all. It means she has fibroids. It's a growth in the abdominal region that can prevent pregnancy in many cases.
So my wife does not have a spirit husband?
No.
Doctor, tell me, what can be done?
It can be removed through surgery.
And her chances of getting pregnant afterwards?
That shouldn't be a problem. But if you do have any challenges, you can visit the most reputable fertility clinic in Nigeria. You should get the help you need there.
Thank you, doctor.
Wow, Mom, your story is so action-packed. I could make a movie out of it.
Yes, it is. But we thank God it's ending well.
So, Mom, you've confirmed that this one is a real pregnancy?
Yes, of course. I am 32 weeks pregnant as we speak.
Okay. If it's a boy, call him Victor.
And if it's a girl?
Victoria.
And if they're twins?
Victor and Victoria!
That's my boy.
Choose wellness. Choose health and vitality. Know your numbers.
This is a corporate social responsibility message from Pathcare, Nigeria's foremost pathology laboratory.
I'm Dr. Pamela, welcoming you once again to Life and Living, brought to you by Doctors on Air. We are fortunate to have with us the nation's voice on fertility care, Dr. Richard Ajayi of the Bridge Clinic. Welcome, Doctor.
Thank you for inviting me.
Dr. Ajayi, this is a very interesting case.
It is.
It certainly is. And there are a lot of cultural perspectives there. Why do you think it took so long for her to get actual adequate help?
Well, I think it reflects the level of development and access to medical infrastructure that we have in Nigeria. The couple lived in the village, and their perspectives was that they had to go to traditional or to religious places to seek help because their understanding of the swollen abdomen was that she was pregnant. They didn't have access to ultrasound scanning, and obviously immediately they came to the city and had an ultrasound scan. They got a diagnosis. The interesting thing, of course, is that you'll be surprised that there are people that live in Lagos that have similar conditions. I mean, I've seen patients come to us with a swollen abdomen telling me that they're pregnant because they've been somewhere and that's the diagnosis they've given them. It underscores the importance of going to the right place for medical help. The regulation is not very strong in Nigeria. So, of course, anybody who can buy equipment calls themselves a hospital, a clinic, a laboratory. So you don't just go anywhere with a signboard. I think it's important to be sure that the facility has the expertise to provide you with a proper diagnosis.
Wow. Dr. Ajayi, what are fibroids?
Well, fibroids are growths of the cells that form the wall of the uterus. The cell proliferates in an uncontrolled manner. They're benign tumors.
Not cancer.
It's not cancer. They have varying sizes, from as small as less than 1 centimeter to as big as 30 centimeters.
They say it's
bigger.
very common in our women here in Nigeria. Is that true?
Well, fibroids are basically seen as a condition that is more common in black women. And indeed, if we look at our data from the Bridge Clinic, up to 40% of the patients that we scan will have fibroids in one form or the other. The important message is that the fact that you have fibroid doesn't mean you have a problem. Most fibroids are benign and do not cause any problems and do not need any treatment because they do not become cancer. So there's no point to remove them if you don't have any symptoms. But of course, the symptoms of the fibroids will depend on its location. If the fibroid is growing from within the wall of the uterus, so-called submucous fibroids, then they can be associated with infertility. Those kind of fibroids can also be associated with heavy menstrual flow or sometimes painful periods. Fibroids that are growing within the wall of the uterus, in particular if they're less than 5 centimeters, tend to be innocuous and not cause any problems. As do fibroids that are growing within the wall on the outside of the uterus, they also tend not to cause any problem unless they're very big.
What type would this one have been, this huge one?
Well, it's very difficult to be sure because any type of fibroid can grow to this size.
So, Dr. Ajayi, something of this size would definitely need to have an operation?
Oh, absolutely. I mean, I think from the story, she had a distended abdomen, and that definitely will be pressure symptoms. The bladder is in front of the uterus, so if it's an anterior fibroid, then you would expect that she's getting bladder symptoms. Sometimes she may even be leaking urine and having continence. If it's posterior, then it could affect the rectum and it could be a cause of constipation and other bowel symptoms. Or it could be on top where she will have splinting of her diaphragm, breathing difficulties, difficulty sitting down. So there'll be a lot of pressure symptoms, and definitely a fibroid of that size would definitely need to be removed.
Now, a lot of people have concerns because A lot of women have died during surgery removing fibroids. How safe is it?
Well, the operation itself, it's a major operation, and it needs to be done by somebody who has the experience and the skill to carry out the operation in a facility with the right equipment. The problem we have, of course, in Nigeria is that anybody has a go at these kind of operations because the control and regulation is not there. So, of course, you get a lot of bad news of people dying after fibroid operations. But the operation itself, of course, it's a difficult operation and should only be carried out by people who have the experience to do it safely.
Are there safe centers here in Nigeria?
Well, of course, there are a lot of safe centers in Nigeria. There are a lot of very experienced gynecologists and a lot of centers that can carry out the operation safely.
Now, Dr. Ajayi, before you go, you said that some fibroids can cause infertility. Can the operation itself, the removal, cause infertility as well?
Yes, some fibroids can cause infertility, and with any operation, you have to weigh the benefits of the operation versus the risks. Now, if you have a small fibroid that's not causing any problem, and you go and operate on it, then the risks definitely outweigh the benefits. And the risks of the operation, of course, are the risk of the anesthetic and the procedure in itself. But we also have data that up to 30% of women who have had fibroid operations will have significant problem with their fallopian tubes as a result of complications of the operation, because the operation tends to be bloody and you can have a lot of blood in the pelvis, and this causes scar tissue which can affect the function of the fallopian tubes. So the decision to remove a fibroid has to be a very strategic one and done with the right infrastructure to prevent the complications. So you don't just remove fibroid just because they're there. But of course, if the fibroid is causing a problem, then we don't have a choice but to take on that risk and manage it effectively.
So, Dr. Ajayi, how do you diagnose fibroids?
Well, the diagnosis can easily be done with ultrasound, either a transabdominal ultrasound scan, which is widely available, or better still, with a transvaginal ultrasound. Or sometimes you need a combination of the two.
Thank you.
Thanks for inviting me, Dr. Pamela.
If you'd like to get in touch with the doctor, you can send an email to doctor, which is DOCTOR, @thebridgeclinic.com, or text fertility to 20050. You can like our Facebook page at www.facebook.com/DOA Life and Living, or follow us on Twitter at www.twitter.com/DOA Life and Living. Till I come your way again next week, remember that ultimately life comes from God, but it is your responsibility to make sure you have knowledge.
Choose wellness. Choose health and vitality. Know your numbers.
This is a corporate social responsibility message from Pathcare, Nigeria's foremost pathology laboratory.
Life and living.